Hi friends, welcome. This is a new standard which has been included in the NABH 6th edition, which states about the preventive and promotive health services are provided in a safe and collaborative, consistent manner. So here the NABH is promoting the preventive healthcare and promoting the health services. So then written guidance, the objective elements are there should be a policy for the preventive and promotive healthcare service. Organization should be defined and evidence based with the age appropriate screening for the non-communicable diseases. Mental health screening needs to be done. Then evidence-based pediatric adult immunization is to be done. Multidisciplinary approach is adopted in the imparting health educations. So let us see. The written guidance governs the implementation of the preventive and promotive care as per the scope of services. So what is the requirement? Requirement is that organization should have the policy which include the scope should be the vaccination services should be there, health check program should be there, antenatal postnatal counseling should be there, lifestyle modification counseling should be there, chronic disease screening to be there, infection prevention education should be given, community outreach program should be conducted for to promote the to promote the health checks and immunization to prevent the non-communicable diseases, right? So next is that organizations shall have defined evidence-based and contextual as appropriate screening for the non-communicable diseases. So the organization should define and implement evidence-based as appropriate screening protocol for the non-communicable diseases as per the national guidelines, right? And the scope should be include the hypertension, diabetes mellitus, cardiovascular diseases, chronic respiratory diseases, common cancers like breast, cervical, oral, colorectal as per the scope, and the obesity. So these are the scope should be there. Screening protocol should be defined for these are the non-communicable diseases. It can be done like age group wise 18 to 29 years. So BMI, BP, lifestyle risk assessment should be done. So organizations should have a policy and the policy should include these other things. So 30 to 39 years age, BP, blood sugar, lipid profile should be screened. 40 to 49 years, BP, fasting blood sugar, lipid profile, ECG, cancer screening should be done. 50 years above, comprehensive NCD panel including the cancer screening, CVD risk assessment needs to be done. Mental health screening and appropriate intervention is advised for the patient wherever applicable. The organization shall ensure that mental health screening is conducted for the patient wherever clinically it's indicated or appropriate intervention are initiated in a timely manner. Scope is applicable for the OPD patient, IPD patient, patient with chronic diseases like cancer patient, your COPD patients, your kidney dialysis patient, your geriatric patients, then antenatal and postnatal patients, adolescents, and the patient with substance use disorders. Right, so these are the things, these are the departments should be in the scope for the mental health screening. Mental health screening, you can use the checklist as suggested by the NABH PHQ-9. This is the tool. So this form can be used for the mental health screening and can be produced as a evidence during the NABH. First, stress management, the patient can be suggested for the yoga, meditation, and all. Evidence-based and contextual pediatric and adult immunization shall be advised wherever applicable. So wherever applicable, the scope should be applicable to the pediatric OPD, adult OPD, antenatal cleaning, occupational health services, preventive health check programs. So these are the area should be uh, promoted for the immunization, right? So organizations should follow the national immunization program, and government should whatever the government is recommending the vaccine is vaccine, that also organizations should promote. With that, organizations should promote the COVID vaccines, your COPD vaccines, pneumonia vaccines. So and the lot of adult vaccine which include the tetanus, TD boosters, influenza, pneumococcal vaccine, hepatitis B, HPV, COVID as per the government requirement. So these are the immunizations should be included in your adult. right? A multidisciplinary approach should be adopted, imparting the health education on the lifestyle modification. So multidisciplinary team is inclusive of the dietitian, clinician, nurse, physiotherapist, occupational therapist, psychologist, and wherever required the MSWs. Scope is applicable to the patient with non-communicable diseases, oncology patients, antenatal postnatal patients, pediatric obesity cases, geriatric patients, post-op patients. So in these cases, multidisciplinary team should be educate the patient on the requirement, right, and the lifestyle modifications. So, what is the identification requires to be done during the assessment? Patient requires the lifestyle modifications shall be identified based on the diagnosis, BMI, risk factor, lab result, behavioral habits. Right? These are the assessment needs to be done for the patient, and as per that, patient should be counseled. Thank you.